Welcome to the Dr. J.J. Thomas Podcast.
All right, monkey is going to be a little bit easier in the sense that you guys kind of have the basic concepts now. So monkey is just a lateral, right? As humans, we have to go straight, we have to go sideways, we have to rotate, we have to anti-rotate, we have to do all these motions. So monkey is like Frogger, but laterally. So monkey, I'm kind of going to be my back to somebody somewhere. Your same ideal in terms of feet straight, and then you're going to squat down as deep as you can with your feet flat and your chest upright. And then you're going to split the distance, essentially, of your one foot in the direction you're leading. And you're not going to reach too far on this one because we want to go lateral. So you're just going to reach wherever's comfortable. Then you're going to allow your heels to come up as you stack your shoulders, push the floor away, and then just replace one foot with the other. So it looks like this. And then split the foot and go back. And split the foot and come back. And see how we're getting deep into those hip sockets? So now we're starting to work towards that like Lego position that babies have and work and need. Okay? Great. But for something like bear, I'm going to want a straighter spine because we're really looking for spine neutral here. Oopsie, sorry, Morgan. And we're really emphasizing scapular work there. For Frogger, I actually want that rib to pelvic connection, so I actually want a more rounded, you're going to have, if they don't have a rounded spine, they have all kinds of issues with probably hip anterior tilt and iliopsoas havoc. So we need that, and again, just go back to like baby play, and when they're playing with their Legos, they're in that kind of rounded spine. I would say that's something we have to restore. Which brings me to the third point. Two people asked, which is, what if your patients can't get anywhere remotely to any of these positions? There's lots of regressions, and as I said, as we go through clinical scenarios, we're going to go through more regressions, but I'm going to give you two, one for each, one for Frogger and one for bear right now. Essentially, bear, you can either regress to like a table. So imagine, or I can do it here. So you could either go here, press, right? And then just do scapular stuff there. Or you can do it in A-frame. Here, and just go from here, right? Or you can go from here. But essentially, I want you to think about loading through the shoulders to get that scapular work, at least for some of the feedback. So whatever shape or form they can get into an overhead position to mimic that bear, but do so in a way that core activates and integrates together, either regressed through amount of weight bearing or amount of weight bearing and standing, or in a more of a pseudo regressed posture this way. For Frogger, the regression is a little bit different in that and I want everybody to try this, but it may be sensitive on the knees. So the Frogger regression I like to use, there's really two. One is this it's a quadruped position, fingers spread, elbows straight, shoulders stacked over wrist. And then essentially what we're trying to get with Frogger is that straight line hip activation on top of a stable base, right? And I'm arguing that the stable base really comes from the shoulder push. So what we're going to do here in quadruped is push this floor away to get that stable base, then slide one knee up towards the heel and translate it forward flat only if they can get there without lifting the hand or without circumducting the leg. Because again, similar to the pronation thing, like if we just let them circumduct, they're not getting that spinal flexion and they're not getting that rib to pelvic approximation that we're really looking for. So I would say try this one for sure. Fingers spread, elbows straight. Slide one knee up. If you can keep it going to sit next to the hand, great. If you can't, stop here. And then go here, and then go here, and just do whatever you can do successfully. So go ahead and try that real quick if you guys don't mind. I'll get out of the way so there's more room on the mat. Yes. Guys, Chelsea just said it, and she's 100% right. This is one of those exploration moves where I realize the importance of the shoulders. Chelsea said, I notice when I load more forward, I can get my hip thrust further better. That's because your body, your hips now feel safe because you're getting that developmental firing that you need, that foundational primal scapular activation pattern that fires serratus anterior, locks it into the abdominal muscles, now allows your pelvis to get the right position for your dang hips to move. Kyle just asked a question that prompted something I left out, you guys. Everybody get back in that quadruped position. And this is ironic because actually the way I found GMB Fitness was through that muscle patient that I was telling you about, that weightlifter. And this cue that I'm about to give you is the one that made him realize that, and because it's a cue that I was thinking of developmentally related to DNS, but he realized it from GMB Fitness. So that was the parallel. So fingers spread, elbows straight. Now the first thing I want you to do is roll your elbow pits forward. Now think as your PT brain, put your PT hat on, what are we doing? We're externally rotating cuff, essentially, right? We're externally rotating the humerus. We're giving more input to, we're setting the scapula, and now we have a more stable scapula on the thoracic spine to allow that serratus anterior push. So yes, I will cue the arms, but Kyle's original question was, will you cue them to externally rotate their entire shoulders through the hands? I actually try to keep it straight like I would the feet. Essentially, in all these primal movements, think of the feet and the hands as the same type of thing. Like in Frogger, where I'm encouraging you to access posterior chain by not externally rotating too much, there are people with structural deformities that we're going to talk about later that you have to compensate a little bit, but ideally, you're going to be straight. Same thing with the arms. Hands, fingers, middle fingers should be fairly straight. That on top of that, you're going to externally rotate just to engage scap stabilizers into the thoracic spine. Great. Now see if that changes anything for you.
It's way less core.
It feels, yeah.
It's easier.
Like it's shoulder core.
Yes, it's
right?
shoulder core, but not as much.
Yes.
Abdominal.
Yes, so essentially we're reorganizing. Like it's funny, like I use that term all the time like it's a thing, and I think it's not a thing, but it is a thing. Yeah. Like it's not something that people talk about, but I say all the time to patients, like we want to activate our shoulder core first. I call it the shoulder core. Because once you, if you think it makes sense developmentally, we don't earn the right to even roll until we've stabilized shoulder core. And so it's the same thing here. Like when we lost rolling patterns as adults, when we lost stability with sitting, we have to go back to the shoulder core. And so what Doug noticed is when we gave that cue, he's like, oh, it feels like less core. It is less abdominals because we're now allowing the shoulder core to do its job and prioritize stability first. Then abdominals can work better, so you don't feel them as much, and hip flexors finally get a break because hip flexors are always trying to work on a non-stable shoulder core, and that's why most of us have iliopsoas that are just always angry. Make sense? Cool.